Okay, so at this point, Andy, what we're going to do is I want to give you a chance to examine me.
Okay.
I think it's always a key thing when we're learning. I can give you feedback as to
Okay.
whether I feel like that MCL, that LCL is being stressed, whether you're doing the anterior drawer test well. We'll do that. You get to practice on the instructor. And then what we want to do is we'll break up, and we'll be 2 and 2, 2 students and 2 students working together. And then I'll be around to give you feedback as to how things are going along. Okay? All right, good. All right, Andy.
Start with the MCL exam. So again, I'm going to put you in a little bit of flexion and produce a valgus stress here.
Right, I feel it there. I feel that my MCL ligament, I feel it's going on stress, so you're doing that appropriately good. So that's the valgus stress. And now let's try the LCL now. All right, you bent my knee a little bit, that's the key. Good, and then, great, great, yep, I feel it, I feel that. I feel pretty solid, I hope?
Yeah, you do. Good endpoints.
Good endpoints. All right, now let's do the ACL.
Okay.
And you're gonna sit on my foot again like that. Yep. And then you're gonna grab the back of my leg. I'll give you feedback. All right. Yep. And I feel it coming forward, and feels like you've got a good endpoint. Yep. So anterior drawer test first. Let's do that. Yep. And then a posterior drawer. Good. Anterior drawer. Posterior drawer. Yep. You're doing that correctly. Great. You want to try that Lockman's test just to see if you can do that too? Right. So it kind of it's hard to relax.
Yeah.
As you saw too. And then you bring it back and forth. So you're trying to bring the tibia anteriorly in relation to the femur first, and then you try to bring it posteriorly in relation to the femur. You're checking the ACL and then the PCL as to which way you're moving. And that's oftentimes what you see when the trainers and the physicians run out in the field with a football injury, and they're doing that to the knee. They're doing a Lockman's test to check their ACL and their PCL.
Okay.
All right, that's great. That's great. All right, so at this point, Brian, why don't you be the next person? Why don't you check me too? So we'll have each one of you do it on me.
Let's start with your straight leg raise so we can make sure your quad tendon and patellar tendon.
There you go.
Good. Okay.
All
Which
right,
one do you want to try first?
Let's try the MCL first.
Okay. So you bend the knee a little bit and like that?
Yep, that's it. You got it. Good. Good.
LCL?
LCL's next. Yep, I feel like you're doing that correctly. I feel that stress right there.
Okay.
And let's check my ACL with an anterior drawer test. Sit on my foot. There you go. Great. Pull it towards you a little bit. Yep, hold there. Good. Kind of bring it and kind of hold it and then go back. Good. Forward. Yep. I definitely feel it moving there. Yep.
Okay, and the PCL.
Yeah. Pretty solid there, right?
Yes, you are.
You want to try that Lockman's test too?
Sure.
There you go. Yep, I feel it coming forward. So let's check my ACL, bring it forward, my tibia, and then the other way. Great. Great. Nice work. Nice work. All right.
All right.
All right.
Thank you.
Andrea, you're last
Okay.
but not least for this part. Okay, so let's have me. I'm going to go straight up like this. Check my extensor mechanism. Make sure I can leave it straight and just let go for a second. And there you go. So now you're checking my extensor mechanism, right?
Okay, yes.
And then what we're going to do is now you want to check my MCL, right? So you're going to do that
So
stress.
this-
Yep, like that. Exactly. Good. And then you're going to go the other way.
My hands in this,
Yeah, sometimes you have to kind of put it actually over here, right?
oh, yeah.
And then hold
yeah.
there and then do that. See, it's kind of that weird maneuver, but you kind of take that foot and you put it right under almost your armpit and do that. That's
Okay.
perfect, perfect. And then if you do that anterior drawer test for the ACL where you sit on my foot is the next one. Yeah, there you go, great.
Do this?
And then, yep, pull forward and then let it go. Then pull forward again. There we go. Maybe one more time, a little harder. Pull forward. And maybe you want to put your fingers right on my joint line, kind of right
Oh,
there,
yes,
so you can
yes.
kind of feel it. You can't see my pants as well. There you go. And then try to bring it forward. Now you got it. See that? Now you bring it forward, then it stops. And then one more time. Good. And then push backwards on my tibia, and that's checking the PCL with your fingers again at that joint line. That's a good thing I didn't emphasize enough, is that you want to put your fingers right in that joint line, just like you're doing. That's good enough. The last one, which is oftentimes harder if your hands are smaller, is the Lockman's test, where you just kind of grab it.
I don't remember this one.
Yeah, it's okay. That's exactly right. So you kind of right here and kind of here, and you're trying to kind of hold my leg here and try to bring this forward as you push it down there. So this hand goes down and that one goes up. And you're trying to move it back and forth. There you go. Yeah, that's it. That's right. And that's called the Lockman's test. Again, quite a bit harder to do, as you can tell.
Right.
And that's why oftentimes if we have smaller hands, we don't do this a lot. An anterior drawer test is a preferred method for now. Okay, that's great. Great.